The first COVID booster for kids ages 5 through 11 has been authorized by the FDA, and the shot could become available as early as Friday if approved by the CDC. ABC News contributor and Boston Children's Hospital Chief Innovation Officer, Dr. John Brownstein, joining me now to talk more about this. So, John, the FDA did not convene its committee of independent experts before authorizing the booster dose. So why do you think that is?
Well, Kira, I think the data is already incredibly compelling. We know that through the months that vaccine effectiveness is going down after that second dose, and that's largely accepted across the board. So there wasn't really a need for an independent review, and there's some urgency. You know, of course, COVID is less severe in kids and adults, but we're seeing that surge now, a second surge among our kids, and we're seeing an increase in cases, but also hospitalizations. They are going up, and very similar to what we saw in February. So there's an urgency to top up that immunity, and I think the data is pretty compelling that we need to move forward with that third shot for our kids.
So this booster shot is 1/3 the dose for those 12 years and older, right? Okay, so just like the vaccine. So what do we know about its efficacy and any risks that could potentially happen here?
So overall, with this third shot, the benefits way outweigh any risk that is associated with side effects. So clinical trials were done, showed that we can create a really strong immune response in that age group. They looked at safety in 400 kids, no serious side effects. The usual side effects that we saw: pain at injection site, fever, headache over the 24-hour period. And it really became clear that the vaccination is a 3-shot regime. And yes, we have that primary 2-dose series, but that third shot is super critical. And I think it's especially critical for our younger kids because, as you mentioned, Kira, the dose is way lower. So you need that additional boosting of immunity to get that sort of more robust response. And I think that's been really shown in clinical trials. And this is why the FDA is moving forward with authorization.
Got it. All right. Well, New York City health officials now are saying that the city has moved into a high COVID-19 alert level as the number of cases continue to rise. So could we see a return of COVID mandates there?
You know, it's possible, but we have to keep following the data. And yes, we're seeing that increase in cases. And I think it's a real underreport. You know, I've been testing at home and rapid tests. Other people have. That data isn't going anywhere. So we generally actually have an undercount of what's happening in the community. But what's important to look at is hospitalizations and deaths. And if those are under control, because we have the tools like vaccination, testing, and also Paxlovid now, that really tells us that we can do what we can to keep transmission down while still not necessarily bringing in these widespread mandates. At the same time, we have no idea what the summer is going to look like, especially in the South. So it's possible we may see the return of mandates, but fingers crossed, we're in a much better place right now.
Agreed. Dr. John Brownstein, thanks so much.
Thanks, Kira.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.